Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Hey everybody, we have our St. Vincent Dr. Dubbaka here to tell us more about obesity and seniors. Dr. Dubbaka, thanks so much for coming.
Good morning, Chris.
Good to see you. When he walked in, I hardly recognized him. He was here 2 weeks ago with, hair, and now it's almost all gone. Got a good summer cut.
We were talking about summer all this while, and
yeah.
here we go, official summer.
Excellent, excellent. Well, hey, today we're talking about obesity in seniors and kind of how that impacts them, and really, does it impact them more than maybe some youth that have obesity issues? First, let's talk about obesity in older people. Is it much different than the younger population?
It is different and same at the same time.
Okay.
The way it's different is because as people get older, their body composition changes. There's less bone mass, lean mass, and less body fluid. So they're more prone for dehydration and all the other stuff we've spoken about in the previous shows. So that puts them at risk for obesity and also at malnutrition and weight loss.
Okay, and I know with getting older sometimes taking more medications can be part of the norm of aging. Kind of talk about the effect of those medications and obesity. Is there a correlation between the two?
That is true, and as we all know, again, there's plenty of medical problems in the elderly, and they're on multiple medications. In fact, it's not unusual to see half a dozen medications that one senior is taking. And on top of that, the medications that are specifically, that usually are prescribed for, let's say, depression, anxiety, inflammatory bowel disease, COPD, especially, these are the ones that are like steroids and antipsychotics. Those are the ones that are more risky for causing weight gain.
Okay, how big of a problem is it, or an issue, if someone who is getting older and aging and a senior who has an obesity issue?
Yes, it is of concern because obesity is like a vicious cycle. Because they're obese, they cannot exercise as good as good as we want them to, and because they cannot exercise, again, the obesity builds up. So it's a tough cycle to break.
Okay, and when talk about some complications with that.
Yes, I mean, and also, just to give you a very specific example, let's take osteoarthritis of the knee, for example. I mean, a lot of people don't want to exercise because their knee hurts. Yeah. But if you think about it, the whole idea of exercising in osteoarthritis is to build that muscle around the knee joint so that the joint itself doesn't take the brunt.
And so it holds everything in place,
right? Yes, the structure, the ligaments and the musculature around the knee holds up pretty good and offloads the weight on the knee itself. So it's more important to do exercise in that situation, but it's difficult. And like you say, the complications from obesity, again, we're looking into 3 broad categories: diabetes, hypertension, and other cardiovascular diseases, and also, osteoporosis, in the sense, if you have to think about it, obesity also causes malnutrition in a way. If you think about it, you're thinking about all the energy excess, but also they're deficient in micronutrients like vitamin D, calcium, and some other, iron and that kind of stuff.
It's not balancing out.
No, exactly.
Okay. Speaking of imbalanced, when you look at the obesity and the gender aspect of it, men not as statistically obese as they get older than women?
That's true. I mean, the WHO studies have proven that women tend to be slightly more obese than men. And in fact, if you look at the national trend between the years 1976 and 2004, they looked specifically at the rates of obesity, and they found that increased from 14 to 32% overall.
Wow.
And we were talking about the population in the 60s and 70s.
Yes.
So that's significant.
When you look at the obesity issues and the problems that come with it, how do you go about solving those things? You talk about someone who's obese and getting elderly and not wanting to move around and exercise to, back off some of those complications. How do you go about solving and getting them up and moving around, I guess?
Right. I mean, it's all about counseling and trying to explain to them the complications, but there's only so much that's possible, so you have to take those limitations into consideration. Okay. There's not a one-size-fits-all as far as exercise recommendation or even dietary recommendation. Really? So I tell my patients, at the end of the day, it's all about the quality of life too. not just the longevity or the quality of the quantity of the life, so to speak. So, you know, it's okay to indulge in an occasional pleasure, so to speak. I mean, as we speak here in the South, the soul food and that kind of stuff.
Yeah, fried food, sweet tea. I mean, bring it on. That's what we're about. So.
I mean, like I said, it's all about the quality of life, too.
All right. Well, we appreciate you coming in very much this morning. Thank you so much, Dr. Dubbaka. You can always contact the St. Vincent Center at the Longevity Center right there, right off St. Vincent Circle. You can call ahead for an appointment if you want to set that up. There's the number on your screen.